It is my great pleasure and with thanks to Professor Atmaram that I present this lecture in the OSAPCon Golden Jubilee Conference. Distal sodium channel block in orthopedics, a new game changer. This is applicable both to retro and metro. DSCB is a terminology coined by the authors for distal sodium channel block of 0.5% lignocaine with clonidine with or without steroid given at specific spots in doses of 1 to 5 ml. Upper limb are alpha, lower limb are beta, trunk portals are tau, and head and neck portals are called caput portals. The portals have a specific location, depth, volume, indication, purpose, and a specified duration of action, all of which is being studied. The effect lasts a minimum of 2 days and maximum of many, many months. And these are not like anesthetic blocks, do not produce motor blocks, and are not indicated for surgical procedures. Initially described for discs and neurological issues, these portals have now found a very wide range of applications. The first upper limb portal is called the alpha 1 portal, which is in the first web space, with the fleshy part of the first web space. Injection is into the muscle, and the common indications are shoulder, humerus, scapula, elbow, cervical radiculitis, and arm and forearm neuropathies. This is a very versatile portal, does not work in Colles, shaft of humerus, or wrist fractures. However, in all the other conditions, the relief produced by this portal is dramatic. Whether we just use 0.5% lignocaine and 30 microgram clonidine or add steroids depends on whether it is a trauma or a neurogenic portal. Here we can see a fractured neck of a humerus who is being treated ergonomically. He was advised Philos by 3 surgeons. I personally believe that Philos is a dangerous implant with very, very selective indications, and its wholesale use must be restricted. Within 10 minutes of the fracture, the person is smiling. His arm and chest will be strapped together just for 3 to 4 days, no more. Because to ensure that the fracture unites, early movements are essential, and macro movements in this area will ensure that the highly vascular neck of humerus will unite within 6 to 8 weeks, sans scar and metal. You can see him on the 5th day or day 3 with a large hematoma bruise on the arm, and he has been encouraged actively to do wall crawling. It is a little tough for him, but the patient is cooperative and he is able to do it. In just the 16th day, without a cast or a plaster or a plate, you can see his function absolutely pain free. This patient is still under follow up, uniting beautifully, and hopefully in a short while should be back to his normal functional activities. The next block is alpha 1A. Alpha 1A block is in the second web space in the fleshy part, and only 2.5 ml is injected. This is a primary trauma portal, and so 0.5% xylocaine is the one that is injected. And in combination with the hematoma block, this is an ideal portal for wrist fractures, closed reductions, Miras, or JES. Here's a Colles fracture, dorsal displacement, radial deviation, alpha 1 block in the first web space is given, and alpha 1A block in the second web space is given. Thereafter, the patient is taken to the operation theater, the part is cleaned, and a hematoma block is given right into the fracture site. The alpha 1 block does not work on the hematoma site, so the patient is having very light pain. Now we wait for 15 minutes for the fracture to become numb, and a proper reduction can be performed and the patient is cast with an unpadded single stockinette layer, single layered fiberglass cast in volar flexion and ulnar deviation, as should all Colles fracture be. This combination of local infiltration, periosteal blocks, and hematoma blocks has produced a game changer in wrist and forearm fractures, which can now be managed without anesthesia or the presence of an anesthetist in the theater, and in the majority of procedures can now be shifted to the outpatient basis, saving the patient and the surgeon a lot of time and, of course, some money. Distal sodium channel blocks, when they were initially described, were seen with a lot of skepticism, as people simply should not believe that injecting in the first web space could have an effect on shoulder, or second web space could have an effect on a fracture of the wrist. However, today, in many countries, numerous surgeons are following this methodology with consistently happy results. Here is a post-reduction X-ray of the patient. She was taken to the operation theater only for immediate post-reduction C-arm images. And normally these procedures are performed in the OPD itself, and the patient is sent to a radiology lab for subsequent X-ray. Alpha 2 portal is in the carpal tunnel between the flexor tendons, which is a primary neurogenic portal for cervical issues, brachial neuralgia, cervical spondylosis, cervical radiculopathy, and occasionally as an adjuvant portal for carpal tunnel syndrome. However, we do not recommend DSCB portals as a definitive management for carpal tunnel syndrome. The alpha 3 portal is above the medial epicondyle humerus and the volume is only 3 ml. This is an adjuvant portal, just like alpha 3 portal, which will be helpful in cervical radiculopathy, brachial neuralgia, cervical spondylosis, fracture neck of femur. We must not go into the nerve. We go away from the nerve above the medial epicondyle. In all these distal sodium channel blocks, we stay away from the neurovascular bundle, but in close proximity. Alpha 4 portal is a mirror image of alpha 3, and it's above the lateral epicondyle, useful for cervical radiculopathy, brachial neuralgia, cervical spondylosis, and fracture neck of humerus. Here we have an alpha 4 portal just above the lateral epicondyle, anterior to the nerve. Alpha 5 portal is a deltoid insertion portal, which is at the level of deltoid insertion. We go in deep, touch the periosteum, pull it out, come to the muscle and inject. And this is adjuvant portal to alpha 1 portal. A combination of alpha 1 and alpha 5 is excellent for a lot of shoulder issues. For all alpha portals, relief starts in about 10 minutes and the duration of action is 5 days to many weeks. The beta portals are the lower limb portals, and here we have beta 1, 2, 3, 4, 5, and 6 portals. Beta 1 is 2 centimeters in front and lateral to the anterior inferior border of lateral malleolus, subfascial depth, and is indicated in sciatica, restricted SLR, hamstring spasm, and all spine level L4-5 issues with a horizontal pain distribution. You can see the cluster of nerves anterior to the lateral malleolus, adjacent to the neurovascular bundle. This is given. Beta 1 portal is 20 minutes, duration is 521 days. Aggressive physio or rehab is necessary. The above picture is beta 2 portal, which is behind the posterior inferior border lateral malleolus. Depth is subfascial. Again, volume is 2.5 to 3 milliliters. And this is a neurogenic portal. Principal indications are sciatica, restricted SLR, hamstring spasm, etc. The pain is either horizontal or vertical. and you can see the level is just behind the lateral malleolus on the posterior side on the lateral aspect of the foot. This again takes about 15 minutes to have its effect, and relief is for 5 to 21 days. Aggressive physiotherapy and rehab for backache and sciatica related issues ensure sustained relief. Beta 3 is the Walker portal, mirror image of beta 2. Level is behind the posterior inferior border of the medial malleolus, indicating sciatica, restricted SLR, hamstring spasm, and spine levels. We can see again, you go behind the neurovascular bundle. You should not inject into the neurovascular bundle. That is the key for DSCB portals, and the time of effect and duration is similar. And as with other beta portals, it is essential to substitute with physiotherapy. Forget my double audio on the back. This is my cousin who had come with severe back pain, restricted SLR, and agony. We had given sacroiliac portal, which is a Tau portal, about which I'll come back a little later. And then we had given her in her ankle in beta 1 portal. She was a 28-year-old little obese lady, and Tau 4 portal is primarily useful for, apart from this, many other conditions. So a combination of beta 1 and Tau 4 portal was tried in this patient. This is an already recorded video, so you'll see two of my faces. It might be a little distracting. Just forget my other face. You can see the patient's SLR at about 40 degrees. She's not able to move it. Other leg, she's able to move a little bit more. She's in acute agony. She's in pain. This is not my clinic. This was taken in my bedroom because she was too shy to come to the clinic. A relative of mine. I am cleaning the Tau 5 site, which is the sacroiliac joint on the affected side. And then I'm cleaning the lateral side of the ankle, which is for beta 1 portal, the most versatile portal. I'm also injecting her beta 2 and 3 portals on both sides because she had a restricted SLR on either side and she had a piriformis syndrome also. So this combination works especially for the failed backache surgeries, people who have had repeated spine surgeries, people who have had interbody fusions and the plates are broken, people who have had microdiscectomies, endoscopic surgeries of the back, any back surgeries that have failed and the patient has still back pain and he has got symptoms of restricted straight leg raise. All these patients do extremely well with multiple blocks. I'm sorry to be narcissist by showing a same video with 3 of L Prakash's in the images, but then you can see a result exactly in 20 minutes and SLR goes to normal on one side and the other side. The patient tells me that she has never felt so happy and pain-free in her entire lifetime, and within half an hour of the injection, she had completely forgotten about her lymph, she had forgotten about her pain, she was having a massive smile on her face, and she was dancing with joy in less than 45 minutes of giving her an injection. That is how miraculous and magical these 3A and beta 3B portals. These are the first and second toe web spaces. Depth is intramuscular, and this is adjoint to beta 3 portals, useful for spine levels L3, L4, L5, and S1, where the pain is vertical, horizontal, or generalized. This is a mix and match approach, and each surgeon develops his own technology, his own methodology, his own experiences, which teach him how to go ahead. Beta 4 portal is 1 centimeter anterior inferior to the tip of the fibula in intraosseous space. The depth is deep. You have to go way down deep, and this is primarily useful for medial ONE, myalgia paresthetica, hamstring spasm. You should be away from the nerve. You should go a little above the nerve into the space between tibia and fibula to the intramuscular depth, and the effect starts in less than 10 minutes. Duration of effect is 5 to 21 days or even longer. Aggressive physiotherapy to break the pain, anxiety, pain cycle will ensure that the patient is pain free for a considerably longer time. Beta 5 portal is a calf portal which is given right into the calf muscle 6 centimeters below the knee joint, primarily useful for intra-articular fractures, painful osteoarthritis of the knee, painful rheumatoid arthritis of the knee, and allied knee pains. This is a very short-acting portal, lasts only 3 to 4 days, primarily for testing if PFO will work or for reducing and casting tibial plateau fractures. Beta 6 is a very, very important portal. The spot is adjacent to the femoral nerve in the inguinal region. The depth is subfascial. This is useful for emergency pain management, femoral fractures, trochanteric fractures, subcapitals, acetabular fracture, dislocated hip joints, pelvic fractures, great tuberosity and lesser tuberosity fractures. The effect lasts for 3 to 4 days, sometimes up to 5 days. And when you're treating neck of femurs or trochanteric fractures conservatively, this is an ideal use. You can see a stable intertrochanteric fracture in an elderly during COVID times who did not want to have surgery. We have just given him a block and walked him, and the fracture united in less than 8 weeks without any metal, without any shortening. Another case with undisplaced stable trochanteric fracture was injected, and the fracture went on to union in 6 days by walking alone. Again, a video in video with two Prakashas showing a live patient demonstrated being treated with beta 6 block alone and mobilization. An 86-year-old lady recovered hemiplegic with a fracture of trochanteric fracture, stable. We all know that fixation of trochanteric fractures carries as high as 30% mortality at the end of 1 year. It is said that less than 66% patients with a trochanteric fracture see first year, first birthday after the fracture, and 40% are unable to walk independently ever in their life. 50% never recover fully. So, are we aggressively treating with DHS, PFN, or Spica? None of these heal the IT fractures. Walking with compression is the one that heals the fractures. Block and walk is a new method for treating intratrochanteric fractures. And here, the best method is to inject beta 6 and make the patient walk. Here's a fresh, stable fracture of an 86-year-old patient, 65-year-old patient. Here, we are cleaning the groin space. Beta 6 block is 1 finger breadth lateral to the femoral neurovascular bundle. The patient was in extreme pain before the injection was given. As it is a trauma portal, we are just giving 0.5% lignocaine along with 30 micrograms clonidine. The neurovascular bundle is palpated. The finger is kept on the neurovascular bundle, and then we go little lateral to the neurovascular bundle right into the inguinal crease and inject just 4 milliliters of the cocktail consisting of 0.5% lignocaine and 30 micrograms clonidine. The time for effect of this portal is roughly 20 minutes, and then you can see that the patient has started moving the leg pain-free after the injection. There she is with the fracture, with no metal, no PFN, no DHS, nothing inside her body. And there she is standing up on her own with assistance of the doctor and a nurse. And given a walker, she will walk with greater efficiency than she would have had if she had had her DHS or PFN 2 days ago. No surgery, no anesthesia, no risks, and no complications, especially if the fracture is stable. You can see without a walker, the patient is partially weight bearing or hopping on her limb within less than 25 minutes of giving her a beta 6 block. So these blocks are revolutionary game changers in the field of orthopedics, which teach us a whole new philosophy of management in elderly patients who are otherwise unfit or unwilling for surgery. COVID times have taught us wonderful lessons, and I had a great opportunity of experimenting DSCB blocks in a wide variety of patients for a lot of non-orthopedic, a lot of traumatic, non-operative conditions with outstanding results. We can see in half an hour of the block, the patient is independently mobile, walking on her own, not being supported by the nurse or the doctor, and walking with a walker. In 2 days' time, the pain relief was a little more dramatic, and the patient was able to walk even better and more comfortably. The Tau portals are the trunk portals and are useful for a wide variety of conditions, mostly fracture ribs. The first portal is Tau 1 portal, which is a mid-sternal portal over the sternum in its middle, the depth that's here. The space is less, we need to inject with some force. 1 to 2 ml is enough. Just middle of the sternum, hit the periosteum and push. Single and multiple rib fractures, viral pneumonia including COVID, severe asthmatic attacks, stress infection, and in helping chest physio. In rib fractures treated ergonomically, injection needs to be repeated every 3 to 4 days. The 2 portal, Tau 2 portal is mid-axillary port. Above picture is wrong. It is given in the mid-axillary line here, and that is the correct line. And as the space is less, we need some force for injection. Effect is seen in 10 minutes or less and lasts for 3 days. So we are using this for single and multiple rib fractures, viral pneumonia including COVID, severe asthmatic infections, asthmatic attacks, and this actually revolutionized the treatment of multiple rib fractures. So we just need to repeat the injections in 3 to 4 days till the patient becomes normal. This can also be used for other issues like herpes and neuralgia. The relief is actually dramatic. Here's a herpetic patient, and in 3 days, it has healed and the pain has disappeared. Much easier and safer than giving toxic antiviral drugs for a very long time. Tau 3A and B portals are supra and infraumbilical portals. It's general physician, general surgeon's portal, not very relevant to orthopedic surgeons, but still very, very useful because a single injection sometimes lasts indefinitely, meaning the patient gets cured of his ailments. Pediatric gastroenteritis, constipation, systemic viral illness, mesenteric lymphadenitis, irritable bowel syndrome, viral gastroenteritis, coronary diarrhea, many such cases with a plethora of medicines and managements given over months and years have failed to work. Tau 4 is what I had already demonstrated earlier in pyriformis syndrome and spondylolisthesis, is at the sacroiliac joint. Extremely useful adjuvant portal for backaches, discs, and allied problems. That's given on either side of the midline. Effect is seen in 10 minutes. Is also very useful in fractures of the pelvis, fracture dislocation of the hips, low back pain without radiculitis, adjuvant portal in coccygodynia also. Next comes the Tau 4 kaput portals or head and neck portals. Head and neck portals, again, part of it is relevant to orthopedics, especially in cervical spine and cervical spondylosis. but also to neurosurgeon and general physician. Caput 1 is a mid-forehead portal or the Bindi portal, exactly in the middle of the forehead. Depth is skull periosteum. The needle hits the bone, it is withdrawn a little, and we are injecting just 1.5 to 2 ml because that is all the space available. This is a fantastic portal for tension headache, migraine, sinusitis headache, and undiagnosed chronic headaches. Time for effect is 15 minutes, duration is 8 to 12 hours, and breaks the headache, pain, anxiety cycle. Less toxic than 650 milligrams of paracetamol, and effect is much, much more dramatic and much, much more rapider. So this is a far better dose than method than aclofenac or diclofenac or paracetamol. K2 portal, caput 2 is above the ear, temporal portal just 1.5 centimeters above the top of the ear. Depth is up to skull periosteum, extract and inject. Tension headache, wry neck, torticollis, cervical spondylosis pain. The duration is 3 days or longer and clearly breaks the pain, anxiety, pain cycle. So this is the caput 2 or temporal portal. I have taken special care to identify and show the portals for you. You are encouraged to study human anatomy, think out of the box, find new portals, experiment with them, and share with us. DSCB blocks are thus opening new vistas in pain management. They are game changers in fracture pain management, very useful for fractures, spine issues, neurological issues. Let us all learn together and share together. Thank you very much for the organizers for allowing me this platform and for viewers for listening to me. Thank you very much for this opportunity.